Patients with myeloma don't have a fully functioning immune system. So it's important that patients always tell us things. An absurd thing is a patient saying, "I don't want to bother you." Right? So if we don't know you're having a symptom or you're having a hard time with the medication, we can't do anything about it. Most patients are not aware of decreased kidney function, so unless there is a lot of kidney involvement, there's no symptoms associated with it. The good news is that most of the time, if the kidney failure is due to myeloma, we can reverse it entirely and get the patient off dialysis as long as we're diagnosed in time and start treatment right away. Another thing that patients will present with is bone pain. The bony pain from myeloma tends to be insidious, which means constant. Nothing really makes it better or makes it go away. Some things can make it worse, like heavy lifting or movement of any kind. It tends to be mostly in the spine, ribs, pelvis, but it could affect any bone. And since myeloma sort of thins the bone, they're at increased risk of fracture. So many times there's a very sharp start. A patient will come in and say, "I picked up the groceries and that's when it started," and it hasn't gone away. It also usually doesn't affect joints, so pains in the joints tend to not be myeloma. It can also cause peripheral neuropathy, which is numbness or tingling in the hands or feet. But myeloma in the spine can also push up against the spinal cord and cause constant back pain and pain that radiates down the legs or causes weakness in the legs. That is a medical emergency that requires immediate attention. Certain therapies can cause peripheral neuropathy, and so we're very attentive to decreasing the dose and putting them on appropriate other therapy, sometimes with the help of a neurologist. Nausea, diarrhea, GI toxicity is something that is also fairly common, and we're quite good at mitigating, using something to prevent the symptoms rather than treating them after the fact.